So we're going to start at the margin phase. You already should know how to get to this phase. And there's two options there. There's magnetic and manual. I like to quickly throw down a margin, just trace around. It's going to be in the right position sometimes and the wrong position sometimes. Either way, you get it down, and then it switches to manual for you on this software version. And I like to make this really big, and I can better see the margin when there's some screen movement sometimes. You're just going to tack it around and stop at a point, and then move so you can see. Your job is to get it as close as you can. And if you don't get it perfect, that's okay. The doctor's responsible for getting it right where it should be. So you move this around, you can see where the margin's jumping off the tooth right there. And again, I like to move it a little bit so that I can see the transition between tooth and margin better. You notice how that screen freezes up too. That's just common with this edition. Hopefully that'll be out of there in future editions. Maybe they'll get it better. Once you get to the stage that you think things are pretty good, got a little edge there, then you're going to grab the doc and let him check the margin before pushing forward. So you should end up with a margin that's pretty darn close. Maybe the doc will change it, maybe he won't. But once you're to that stage and they've checked it, before I get them to check it, I would always save your work. Get the doc, they'll check the margin, and when they're ready and we think the margin's where it needs to be, we can push forward. Get done saving. And so we're just gonna hit this forward button, and it's gonna propose a restoration. Sometimes we'll change the thickness on a restoration depending on the material. Right now, one of the materials we're using is called Empress, and a minimal thickness on the actual axial wall can be about 700 micrometers. They call it a radial wall. So I'm going to change it. I'm going to drop that down to 700 and hit OK. Now it's already given me a proposal, and so if I felt like the proposal wasn't very good and I wanted to recalculate it with that different model, minimal thickness, then I could. But as I look at it, minimal thickness didn't affect really anything, so I'm not going to recalculate it. But if you want to recalculate it, you can go over here to the recalculate button and hit recalculate. And with a new minimal thickness, it might not make it as bulbous and bulky, which is kind of nice. So when we're designing, we want to start big and then go small. We have several things we're trying to accomplish, but the first one is we're going to line it up against the opposing tooth. So we want big, we want both the upper and the lower arch present, and we want to see how it fits against the adjacent tooth. And you can see that the buccal cusps on the upper are fitting outside of the buccal cusps of the lower. And you can see that the lingual cusps of the upper are sitting in the groove, the central groove of the lower molar. That's a normal relationship. Sometimes you'll see people in an abnormal relationship. So if you have questions on that, just do your best. And you'll learn over time what an appropriate relationship is in different scenarios. But for right now, start big. Does that look like it lines up? The next thing, we get rid of the lower jaw and we see how it looks on the upper jaw. And this is kind of tough since this patient only has a few teeth here. But one of the major things we want to do is make sure the marginal ridges line up. The marginal ridge is this little part of the tooth here and this part of the crown here. And those edges should line up, and you can see that the tooth in front of it is taller than our crown right in the area of that marginal ridge. I'm not looking at bite yet, but the thing we're going to do is we're going to line that up. So I'm going to go to the position and rotate button, and I'm going to grab that crown and I'm going to make it taller. Who cares what I did to the bite? I'm lining up those marginal ridges. So now we've got a tooth that has the same marginal ridge height as the adjacent tooth. And that's important. We've got a tooth that's about in line with it. As we look at it lined up, well, that looks about like we want it to look. It's lined up. This tooth should be a little narrower. That's a very big tool to move the crown around with. So we looked against the lower jaw, and then we looked against the adjacent teeth, or tooth in this case. And now we're going to get started doing the things that are a little more fine-tuned. We're going to take this and we are going to get rid of some height here so we can get our bite right. You can see my minimal thickness is being violated right there. That's okay, we'll figure it out. We'll get this taken down, this taken down. Try to accommodate her collapsed bite on this. This is actually a tougher crown than most to design, so I think this is a good example. So, wow, that really hollowed it out. Really hollowed it out right there. So, let's take this buccal cusp down and change in a whole cusp here. I'm going to do that a little more with the tool that changes the anatomical part of it. Still pretty bumpy there. Not going to get the best anatomy on this one for that reason. All right, well, let's smooth that out and fix our error, our minimal thickness. Lots of ways we could do that. We could also use an add tool. We could use the circular shape tool. Add some of that back in, take some of it back out. So our bite's pretty normal there. Good. So, all right, so we got the edges lined up. We've accommodated the awkward bite that this patient has clear in the back. And we've got a crown that looks good. Last thing we're gonna do is we're gonna get rid of the upper jaw. Remember, start big and go small. And when there's no adjacent tooth, I prefer to have a little bit of yellow on this. Be a little finicky. That might be a little too much, but it might be just enough. We'll make that nice and snug against the adjacent tooth. We want this embrasure space, or this triangle of space that's on the lingual, and the triangle of space that's on the buccal portion of the crown and tooth, to be symmetrical. So about the same amount of curvature on the tooth should have, the crown should match that and coming in right there. We maybe a little less full on this coming in here. So let's fill that out a little bit. Let's tip that over just a touch and pull this over just a little bit. So that closed it up just a little, and they're a little more symmetrical now. So our embrasure spaces look good, our contact looks good. Let's double check that contact. It's a little yellow, maybe even a little less yellow would be nice. There, that's a little bit. Either way, we want that nice and snug. Usually I'll just do green if there's a tooth on each side, but yellow if there's only a contact on one side. So I think that gets us through. We ended up with a very good proposal right off the bat, and sometimes we won't. So I'm going to show you how to change that. We're going to hit the back button, and we want to get back till we can set the model axis. The model axis is really going to give us the orientation of the tooth in the head. And we've got a decent model axis, even though this isn't really on. So if we're actually setting it, we would want to put this to where the midline's on, to where the tooth is in the right spot, to where this angulation is appropriate, both in this one and this one, everything's level. So if we wanted to change our model axis, we want to go back and set it so that everything lines up and everything's level. So let's mess it up, okay? let's go back and see what an inappropriate model axis does. And we'll just kind of throw this all over the place. I can't grab that. Either way, we've messed it up really good. We're going to hit OK. So remember how our first one was OK. Let's go forward. Our margin's already drawn in. It's going to give us this proposal now. And because our model axis is all messed up, the proposal's probably going to be at a different angle, and it's going to be all weird. And so if you get a weird proposal, man, the tools just won't pull it the right direction. It won't give you right off the bat something that's very workable. And a lot of people might try to take this and say, well, let's work with this. Let's get this down to where we need it to be. And they're just having a hard time. It's just really glitchy. So model axis is a tool you need to know how to use, even though most of the time you won't use it. Again, we can take that, we can set it back, we can get it closer to normal, and raise it up a little bit. And just a few changes to model axis. We hit OK. It's going to recalculate, and let's try another proposal and see what it does for us. We'll step forward. Just those small changes there will hopefully give us a crown proposal that's pretty accurate. So you usually don't have to mess with that, but if you get something really weird, the computer didn't do it right, and you'll need to. And again, set my marginal ridge really low because that's where the bite is at on that back tooth. So tougher design on this one, but it illustrated a few of the concepts. You're going to get the doctor at this stage too after you've designed it, and they're going to check the final design of the restoration. Before you go get the doctor, as always, save and then go get the doc. It saves your work and it doesn't glitch out on you. And then after that, you'll get ready to mill. So thank you for listening to that.